My name is Anita Muller, and I am a Master's of Science in Nursing Education student at the University of Phoenix. For my practicum lesson plan, I chose a program title of Safety Considerations when Caring for a Stroke Survivor. My program's total program time is 16 hours, and it is designed to promote an awareness of safety considerations among unlicensed nursing staff necessary when caring for a stroke survivor. The caregiver's role in ensuring stroke patients remain safe during the rehabilitation process is examined. Content includes stroke warning signs, use of safe patient handling equipment, compliance with fall prevention initiatives, safeguarding dysphasic patients, assisting with bladder retraining, and techniques for communicating with an aphasic patient. Demonstration and return demonstration of knowledge and skill in simulated settings and application of knowledge in case studies will be incorporated. Target audience identified were the unlicensed rehabilitation caregivers, which include certified nursing attendants, rehabilitation associates, and rehabilitation technicians. Course modality is asynchronous, and that relates to the pre-program learning activities identified. The instructional design model is cyclic inquiry instructional model, and the instructional design method is discovery inductive instructional method. Course topics include an introduction to stroke, sighted neglect, fall prevention strategies, feeding dysphagic patients, communicating with an aphasic patient, bladder retraining of the uninhibited neurogenic bladder, use of safe patient handling equipment for lifting, transferring, and positioning, and maintenance and prevention of skin integrity issues. There are 10 course objectives, and for each of the 10 objectives, I have identified Bloom's taxonomy domain, learning domain, and I have selected those in the cognitive and the psychomotor domains, and I have chosen a variety of different levels within each of those 2 learning domains. Reading and preparation required includes reading patient education handouts with topics such as right versus left-sided stroke, injury prevention after stroke, and complications of stroke. I have also required that the participants watch and complete the post-test for the following televised patient education videos: fall management, dysphagia after stroke, and diet considerations post-stroke. Also, the patient education lesson plans that are used on the inpatient rehabilitation service, including blood pressure monitoring, diabetes management, and visual complications and stroke prevention strategies, are further pre-program reading assignments. Materials to review include the bedside communication tool, the bed and wheelchair alarms, the environmental signage and bedside setups in preparation for attending the program. That activity will be completed at the bedside in the clinical setting. Content to be covered in the sections include, in the introduction to stroke, they will receive information on the definition of stroke, transient ischemic attacks, the incidence and statistics associated with stroke, types of strokes, right versus left, so they're very clear as to what the clinical presentation of the 2 patient groups look like, risk factors that cannot be changed associated with stroke, risk factors that can be modified, signs and symptoms of stroke, signs and symptoms of TIAs, diagnostic measures for diagnosis, preventative measures, immediate treatment options, rehabilitation programs and goals, and comorbidities of the stroke patient. For this section, the participants will view a living post-stroke from the patient's perspective video, which is a 20-minute video that provides a visual and an audio learning opportunity regarding from the patient's perspective what it's like to live with a post-stroke. The next section on sighted neglect, I will discuss visual field cuts, the dietary issues, protecting the neglected side, interventions for addressing the neglected side, and room positioning for that patient. For this section, the participants will participate in role-playing scenarios, and there will be a situation where a participant will role play being a sighted neglect stroke patient, and problem solving as to where the patient should be placed in the room, how they should set up their food tray, and other safety considerations associated with caring for a patient with sighted neglect will be role played by 2 course participants. Fall prevention strategies include safety at the bedside and what should and should not be included on the bedside table, the issue regarding side rails depending on affected side, and call light, urinal, bed height, lighting, and environmental hazards associated with bedside safety. Signage for the given practicum setting, which include communication boards, fall risk level signs, falling leaves, falling trees, and moderate and high fall risk signage will be shown and reviewed and questions answered. Alarms that are utilized in this setting include both bed alarms and wheelchair seatbelt alarms. The bed alarms will have a demonstration provided. The wheelchair seatbelt alarms will also have a demonstration provided, and each participant will have an opportunity to activate and deactivate the wheelchair seatbelt alarm and replace the batteries. Reachers are also routinely used with certain stroke patients. They will be available in the learning setting, and the participants will have an opportunity to utilize the reachers in picking up several select items. The role of the care companion and post-fall huddles will be discussed. Feeding patients with dysphagia will include information about what dysphagia is, signs and symptoms of dysphagia, evaluation and diagnosis, treatment modalities, side effects, positioning issues, suctioning and equipment use, cutout cups, modified diets, and thickened liquids. The participants will watch a 15-minute short video fluoroscopy that demonstrates normal and abnormal swallowing. They will break up into pairs in a lab setting and take turns positioning their partner for feeding as if they were a dysphagic patient. Also in a lab setting, there will be a high-fidelity mannequin utilized who will be in bed, and there will be 34 inconsistencies simulated at this bedside that the participants will have an opportunity to work together to identify and rectify. Once this has been done, each of them will be discussed as a group with the educator. Information associated with communicating with an aphasic patient includes the definition, incident, causes, and signs and symptoms of aphasia, diagnosis, expressive aphasia versus receptive aphasia, and the relationship between that and global aphasia. Issues regarding reading and writing difficulties and communication techniques for communicating with patients with dysphagia, aphasia will be discussed. Communication boards and devices will be discussed, and a 20-minute video depicting communicating with a receptive, an expressive, and global aphasic patient will be provided. Additionally, demonstration of different communication boards will be availed, and given case studies, the participants will be able to apply information learned and select the correct communication device for each of the case studies. Bladder retraining of the uninhibited neurogenic bladder includes the type of bladder, the issues regarding frequency, urgency, nocturia, the 3 steps of the program itself, and the goals of the programs. The participants will have an opportunity to role-play clinical situations of caring for a stroke patient at each of these 3 steps of the uninhibited bladder training program. Small group discussions will be encouraged so that they can support one another in discussing and answering questions regarding to their specific relationship in the bladder training program process and their association with patient success. Use of safe patient handling equipment for lifting, transferring, and positioning will include an opportunity to have a demonstration and provide a return demonstration using the AirPal, the LigaRoll lift, the roll-on walker, the Sabina, Golfco, Viking lift equipment, and also battery charging and use of slings. Additionally, each of the participants will have an opportunity to demonstrate how they would recharge the battery for each of these different pieces of safe patient handling equipment. And then in small group discussions, they will identify, given their assigned clinical setting, which of these types of equipment is available on their unit, and in what situations would they use or not use these different pieces of equipment. Maintenance and prevention of skin integrity issues will include positioning and transfer information, skin checks, skincare products available in this particular setting, the use of diapers and paddings, incontinence issues, wheelchair pads, specialty mattresses and overlays, skin cleansing, and the hemiparetic side increased risk. Each participant will have an opportunity to position another participant for maintenance of skin integrity, and they will complete a full body skin check of a clothed participant. Small group activities support verbal and social learning styles and have been incorporated into my program. Role playing supports verbal, visual, and social learning styles. Sharing of assertions regarding concepts or topics supports verbal and social learning styles. Use of physical objects supports visual and physical kinesthetic learning styles. And summarizing clinical assignment and sharing with class supports verbal and social learning styles. And problem-solving discussions supports verbal, social, logical learning styles. The objectives are very directly aligned with all of the content in the program, so there is a relationship between the information presented and the objectives for the program. The time allotted for each portion is as follows. The Intro to Stroke will take 2 hours. Sight and Neglect, 0.5 hours. However, additional information will be incorporated throughout the other topics. Fall prevention strategies will be 1.5 hours. Feeding patients with dysphagia will be 2.5 hours. And communicating with an aphasic patient, 1.5 hours, which will conclude the first day. Second day includes bladder retraining of the uninhibited neurogenic bladder for 2 hours. Use of safe patient handling equipment for lifting, transferring, and positioning, 4 hours. And maintenance and prevention of skin integrity is 2 hours.